Hi, everybody. My name is Jason. I am 54 years old, and at 52, I was diagnosed with prostate cancer that had metastasized to my spine. And on this channel, we talk about it and we talk with other survivors. And today, I've got a guest. I'm joined by someone I had the chance to meet at the Zero Cancer Support Group Leader Conference in Las Vegas back in August. He's a prostate cancer survivor. He's a father with kids attending Ivy League schools. I hope I got that right. And he's also the director, president, and board member of TexUs2, TEXUS2. We haven't had a lot of time to get to know each other yet, so this conversation is as much an introduction for me as it is for you. But I'm looking forward to hearing his story, what his journey's been like, how he's managed his treatment, and how he drives his advocacy. Thomas, welcome.
Thank you. Good to be here.
Did I get anything? Did I get anything right in that intro?
Enough, right? I've actually had one kid graduate from Ivy League, PhD in material science engineering, and I have one left there. Ironically, the same school, but doing a PhD in psychology, and should be done about this time next year if we keep our fingers crossed and the creek doesn't rise.
Oh, that's awesome. Yeah. Well, that's really cool. From psychology to material sciences. So when they have interests like that, that kind of gives a little insight into maybe your background and your history. Because if kids are able to study whatever they want, whatever they're interested in, they get exposure to things that they want to pursue later on. So tell us a little bit about who you are outside of your cancer, your life, your work.
Yeah. So I was born in Selma, Alabama. My parents migrated west to Los Angeles when I was 9 months old. I was raised there, went to school there all the way through university. I have a master's degree in geophysics from Stanford, and I worked in the oil and gas industry for 30 years. And on top of that, I'm very active with my church. I do a lot of public speaking, either teaching classes, pulpit ministry, and other things. Those two things keep me busy. In 2014, I think it was, I retired from oil and gas and migrated into personal finance. I'm a financial advisor. And I also advocate, as you mentioned in the intro, for prostate cancer awareness and support for those that have been diagnosed here in the Houston, Texas area.
Oh, that is awesome. That's quite the background. And yeah, that's quite the master's degree too.
Yeah, I stumbled into it as I stumbled into prostate cancer and eventually prostate cancer support and awareness. It was never a plan. It just kind of happened that way.
Yeah. So when were you diagnosed? What was your initial reaction to being diagnosed? Because we all kind of experience something.
Yeah, good question. I was diagnosed in 2008.
Oh, wow.
What happened was earlier that year, so it was August, I got diagnosed, but early that year, I was 48 at the time. And I was waiting for my libido to finally kind of start to go down because mine had never gone down. It started high at 12 or 13 whenever puberty hit, and it just never let up. And I kept waiting and waiting. And so here we go. I'm 48, and all of a sudden it fell off the cliff. And I thought, finally, it's here. Life is happening. My wife kept egging me to see a doctor. She said, that's not normal. You need to see a doctor. Finally, I went to see a doctor, my PCP. He had been tracking PSAs, prostate specific antigen, for years. And mine was usually around the 2 range, 2.3, 2.4.
Okay.
When I saw him early 2008, or maybe 7, he said, it's up a little bit, but it's not up high enough to be worried about it. We'll just check it, So 6 months later, checked it again. It was up a little bit more. He said, let's send you to a urologist. So now it's early 2008. And urologist looked at me, he goes, you look healthy. Everything else looks fine. And your PSAs are not high. So he said, let's just watch it. So 6 months later, checked it again. And it was just up. I mean, not enough to freak you out, but it was up. So we went for the biopsy in August, I think it was, of 08. And that's where they found a couple of cores of cancer. I was Gleason 3+4 at that time. Okay. And as you mentioned, it freaked me out. I remember the urologist telling me, he said, whatever you do, stay off the internet, which of course,
Yes.
my,
Yes.
my antennas were just buzzing at that point. Like,
But
what does
you,
he want me to know?
yeah.
My gosh. And, just to be fair, Jason, I was looking for a solution, and I was eager to find something non-invasive. So I was looking at all types of quote alternative therapies.
Yep.
I found in Atlanta a naturopath doctor that looked pretty reasonable, had really good reviews. So I flew there
Oh,
to
wow.
meet him. He looked at me, and the first thing he said was, Mr. Reed, you're going to be a hard case. And I'm like, dude, you don't even know me. Why would you say that? And he said, well, Tom, he said, Mr. Reed, here's the thing. Look at you. You clearly work out. You clearly eat well. You don't drink. He just ran down the gamut. He said, normally when people come in here, they're overweight, they're doing this. And it's easy to say, stop that, and we'll see some really good results. But in your case, that's not true.
It sounds like
Here's
you'd
the
already done all the things. Yeah.
Oh, I was doing them. I was exercising. And, I wasn't eating a great diet. I mean, I like cheeseburgers even to this day. But he said, look, he said, Mr. Reed, be straight with you. And of course, we went through an exam, but he said there was nothing there. He said, here's the deal. You're young. I was 48. By now I'm 48. He goes, look, you're young. You've been diagnosed with cancer. The cat is out the bag. He said, there's no pill. There's no diet. There's no alternative thing out there that's going to make your cancer go away. He said, the best
Mm.
thing you can do is treat this aggressively. You pick the treatment. He said, radiation, surgery. He said, but you need to do something aggressive. Don't fall for pills. Don't fall for diet and exercise. He said, you need to do
Yeah.
something aggressive. He saved my life. When I came
Wow.
back to Houston, I was pretty determined. I had already made another appointment with another alternative therapist in Phoenix, and I went to see him, but I was not impressed. So I ended up with MD Anderson, and this would have been fall of 2008. In 2000, December 2008, I got a Lupron shot.
Mm. Yep.
A lot of fun. I know you've
Yeah.
talked a lot about that, so I won't go into it. 3 months later, I got my second Lupron shot and started proton radiation therapy. I think I had 38 sessions thereabouts. So by April, I was ringing the bell. I didn't have any more Lupron shots after that. I think it was September, October, my testosterone started coming back. And I've been tracking testosterone and PSA since, what is that, 2009, 2010.
So you had options. They could have done surgery. It
Yeah.
sounds like you didn't have any Mets,
Nope.
but you chose proton radiation
Yep.
and Lupron to help get those cells in a situation where the radiation would work even better. What made you choose that treatment over surgery?
At the time, remember, this is 2000, late 2008, going into 2009. I had been aggressively all over the internet, and I found a website, Yana, YANA, You're Not Alone Anymore. And in there, they had done a very good job. I think an engineer had actually built this site so you could actually search on it and you could look at different modalities of therapy and hear what the actual patient was experiencing post treatment. So you can
Oh,
look
that's
at
awesome.
surgery, you can look at external beam, you can look at proton, you can look at just all these different things, and they segregated into different PSAs, different Gleasons, different staging. You could just, and then you could see their comments of how they reacted to each of those treatments. And at that time, the laparoscopic procedure was air quotes new. And
Yeah,
so
yeah.
the results were not impressing me. There were a lot of guys talking about issues with urinary incontinence, erectile dysfunction. And every time I read about the proton guy, He was out playing golf and jogging and doing triathlons during treatment.
That would make me want to do it too. Absolutely.
And so, I contacted Loma Linda to try to get in the queue. And when they found out I was in Houston, they said, "You realize that MD Anderson has just opened up a proton therapy and they are treating prostate cancer." I said, "I'm aware, but you guys are like top of the list because of experience." They suggested going to MD Anderson for a couple of reasons. One, it was local. And two, I wouldn't have to wait to get in the queue. They could get me in right away. And so at the end of the day, my insurance covered it 100%. And that's what I ended up doing. The
Oh,
Lupron was an added thing. They didn't say I had to have it, but I felt since I wasn't doing surgery, to give myself the highest probability of success, I would do it, and that's how it came about. But I was not like encouraged to do it. I wasn't prompted. I was just told that there is this adjuvant treatment you can choose, and it worked out. I mean, I'm still here. So that was 9. This is 15. 16 years later, no recurrence. I just got checked. My PSA was zero point 0.2, and that's my nadir. I've been zero point 0.2 for a long time. Good testosterone. I think my testosterone was over 600. Don't remember the exact number. I'm
wow.
66, and I don't take anything. I take uh, what do you call it? Not a DE or omega-3 or fish
Oh, yeah,
oil or
yeah.
something. And I take
Okay.
that twice a week. I was taking it every day for the first maybe 6 months, and now I just take it twice a week as a maintenance. Um,
Okay.
I get my daily dose of diluted beet juice for blood, and uh, that's what I do to maintain. I've been very fortunate. Things are still working pretty good. And I think we talked about this, Jason. One of the challenges when you've gone through treatment, or if you're in treatment for anything urinary related, it's hard to know how much of whatever you're experiencing is just due to natural aging, how much is due to the treatment you chose, and how much is a combination of both. And so
Oh,
I feel fortunate to be here more than anything else. And I'm pretty fortunate that everything still works. I'm still urinarily, continent. Libido, not what it used to be, but again, I'm 66 and a cancer survivor. So how much am I supposed to be experiencing?
right. I don't, yeah, don't know.
I don't know.
That's tough.
Yeah, but I'm here,
Well,
and physically good. Yeah,
you're doing really, really well, and you've been doing well. I mean, that is a large number of years of
yeah.
success that'll be encouraging to the viewers.
I hope so.
Um, we don't, and I've not talked to anybody that got proton radiation.
Hmm.
And I'm surprised that your insurance covered that instead of driving you towards the external beam radiation, the more
Yeah.
traditional, what the first thing they offer up, right? The proton radiation is interesting because how it delivers its
Yeah.
energy. So, external beam radiation is gamma radiation that goes through the tissue and it delivers a dose to everything in its path all the way
Hmm.
through. And as it's delivering its energy, it reduces energy, right?
Hmm.
It's delivering energy
It's
to
absorbed.
tissue, and then
Hmm.
yep, it's getting absorbed, and then it hits the prostate. So they have to ramp up that beam so that they figure out what the amount of dose is they want delivered to the prostate, because it's going to drop a little bit as it's traveling through your hips and stuff, hit the prostate, and then it continues through. So you're worried about colon cancer, you're worried about hitting your bladder, you're worried about all that, right? And
Yep.
proton radiation is different because there is a phenomena in radiation called Bragg peak, Bragg. And what it does is it travels through but doesn't deliver its energy until it gets to a certain point. It's kind of like, oh, it's a good
What do you think
analogy.
about mortars? Um, if you lob a grenade or a mortar while it's traveling, if you time it right, it
Yep.
doesn't explode and does no damage on the way there. But if
Yep.
you time it right, then when it arrives at the place where you want it,
Yep.
in a
Then it
sense,
just,
that's how Proton works. It's
yeah.
called the Bragg's peak is a velocity type phenomena where you determine what the tissue is that is traveling through, how thick it is, and now you can determine what velocity you need to be at the prostate where that energy is being delivered. And so at the time, it was thought to be a much cleaner way to deliver radiation.
Yeah.
And the way I got it done, it was aimed on each hip. So that you do the left hip, then they rotate the machine, then they do the right hip.
Okay.
Um, and so that was it. You know, every day you go in. At the time, they were using what they call a balloon, and basically it's a prophylactic that's filled with water inserted into the rectum, and
Oh, yeah, yeah, yeah.
it's done to create contrast so the radiologist can see the prostate. And so, you know, you go in and prep, you drink enough water to get the bladder into a certain position. They use the balloon to stabilize the position of the prostate. And they actually use ultrasound to make sure that you're positioned in the right place. And they have a machine that you sit on in the same place every time. And then they zap you, one on the left side, one on the right side. The total time, I don't think I was ever in the actual room itself even 10 minutes. And there
Oh,
was a
wow.
cohort of guys I went with every day. I'm going to say 10 or 11 of us. You drink your water, get your bladder ready, and then you just all file through there and they just keep you going. I believe at that time they were running that facility probably 12 hours a day. Now I think they run 24 hours a day.
It's amazing how many men are having to deal with stuff like this. But that's fascinating. I really like that that you are an example of how successful it was.
Yeah.
That's fantastic.
Yeah. They
So
didn't do the spacer. Are you familiar with the spacer,
I had the
Jason?
space ore. Yep.
Okay, they weren't doing it at that time. And so there was for me some rectal damage, if you understand the physiology of where the
Yep.
prostate is, where the rectum is. But I would imagine today, as long as the person can tolerate it, they're all getting spacers, whether it's just the standard external beam, proton. As a matter of fact, the way they're doing the external beam now, they actually change the dosage and they change the position of the radiation machines such that they say they're achieving the same results as proton and at a
Yeah.
much lower cost. I've heard
I
that, but I don't know.
I came across that talking to a radiologist. They're saying that they're able to, in fact, he said they're able to dial in the
Hmm.
external beam radiation to the point where they're not doing the space or the
Oh,
spacer
wow.
as much anymore. He
Okay.
says he says a lot of times they don't need it.
Hmm.
There are cases somebody has an oversized prostate that is really pushing up
Hmm.
on the tissue or something, then they'll consider it. But he says a lot of times they don't do the spacer anymore. Like
Hmm.
there was a 5 year ish period where it was really popular and really good, and then the external beam radiation took an advance.
Hmm.
It advanced to the point where they were able to really dial it in.
Wow. Well,
So
that's good news because I mine got radiated, and as part of the side effect, about a year later, because they always told me I read about the rectal bleeding, and for almost a year I had no issue. And about a year later, I had this urgency to pass gas. And I remember
yeah.
going to, the bathroom and, blood came out. And it
Oh
scared the living
no.
bejesus out of me because I'd
Oh,
never
I'll
had
bet.
rectal bleeding.
I,
So I went and got a colonoscopy and
oh
at
man.
MD Anderson because I was still covered. And they said, no, it's just the healing process. It'll probably go away. And it did. But the first time you see that, it's it gets your attention.
Well, and that's something I don't think that they are extremely clear about is how long, when you get radiation, how long is that healing process? And it can be 1 year, it could be 2 years.
Yeah.
Like it is not just months. And
Yeah.
like I've shared on my channel before, I had bladder issues
Oh,
for up to 2 years. I was
wow.
peeing blood for over a year, about a year and a half, off and
Hmm.
on, and there was no telling what caused it and when I would pee blood and when it wouldn't. But like the colon, that tissue takes time to heal, and the bladder takes time to heal, and so year and a half, 2 years even.
Yeah,
And
that was it shocked me it took so long to see that, to notice it. It may have been happening, but it, like I say, right about a year later is when boom. And I probably only had all together, I'm just going to say 5 episodes, and let's just say over a 1 year period, but never just like every single time. It was just these episodes, and eventually it died down and eventually just stopped. And so I'm actually due for another colonoscopy. I go, I think, every 5 years. Not that I have an issue with cancer or polyps.
right.
It's just age. You see, I'm black, and so that's a risk factor as well.
Yep.
And so I'm due to go back and see again. But the last time there weren't any issues with that area of radiation. You can see this. They say they can see the scar tissue. It's healed up, and you're
Okay.
on with life.
So that means that all that time you were at risk for infections, because those kind of infections can be bad. They can
Yeah,
develop, they can progress very, very bad.
yeah.
Struggling to find a better word than bad.
That's a good enough word for now.
Good enough.
Yeah. Yeah,
Yeah.
no, I feel, overall, all things considered, I feel very blessed because I had a very proactive PCP who was taking PSAs on an annual basis. We would do like an annual wellness check, and he had a history on which he could compare any changes. And
That's
there
good.
was a period where I believe it was the AMA, American Medical Association, or whatever they call themselves, suggested that until you turn 50 or 55, you don't need to worry about PSAs. After age 70 or 75,
Yeah.
you don't need to worry about PSAs. And I had this doctor that was doing it anyway. And
Good.
I'm very
That is
fortunate.
awesome.
Looking backwards, yeah.
That
He was,
is, that saved your life.
I think so.
Yeah.
Yeah.
So, how do you share your cancer story with others, like your friends, your family, coworkers, your church? Do you
Yeah.
find it easy to be open, or do you hold back a little bit? Does everybody you meet learn that you have cancer?
For me, I don't lead with. If we have an opportunity to share things about ourselves, then I bring it in, and I'm very blunt. If I'm speaking publicly at a health fair, as an example, then I'm very, very blunt. I've had the opportunity to speak on radio programs that were promoting health, and those radio programs, because you only get a few minutes, I'm very blunt.
Yeah.
I don't hold back at all. I am trying as best I can to be transparent about the challenges, but also to be honest that for me to be on this side of the rose garden is a good thing. I don't know that I would be a blessing to my family if I were looking up at the roses versus
Mm,
looking down at them.
yeah.
So, so
Wow.
I try to be
Wow.
blunt, Jason. I try to
That
be
is
as
visual.
blunt. I mean, just bam. I was on a radio program a couple of years ago, and I said to the audience, and it was a black radio station that had a predominantly black audience. I just said, guys, I'm gonna just be blunt with you. What got me to the doctor was my libido went away, and my wife said it wasn't normal, and I went to the doctor. I'm telling you that if anything is happening down there, you having difficulty pissing, you're waking up a lot at night pissing, you're spraying your pee all over the toilet in the urinal, go to the doctor. Don't mess around. And I talk like that.
Yep. Oh, good. Good.
Yeah.
That's
Yeah.
good. And again, a lot of times they say that well, you were there, that the Zero Cancer Support Group leader, that panel of doctors, one of them had said they were talking about there's some YouTube doctors that are saying, hey, these are the early signs of prostate cancer. And they were like, just so you know, that's complete bunk. There
Yeah.
are no early signs.
No.
And when you start having symptoms, it's, it's not too late. There's still treatment options, but there's no preventing it at that point. Like you said, the cat's out of the bag.
Yeah.
Yeah.
We might as well mention it here as we're passing by that for a lot of men, and I'll speak to men of color, we're more susceptible to prostate cancer. It tends to also be a more aggressive type. And for many men, and again, I'm speaking to men of color now, we tend to put out doing anything until we're either in significant pain
Yeah.
or we're passing blood in our urine. And I'm just going to say bluntly that don't wait. The time to be proactive is today. If you have the opportunity to get a health wellness check, and I get them annually, whenever I'm getting blood drawn for any reason, I tell the attending physician to include PSA and testosterone. I don't care if I had it checked
Oh,
2 weeks ago.
Yep.
If for any reason they're taking blood out of my arm, we're getting it done again. This is the one cancer, and there may be others, but since we're talking about prostate, this is the one that if we can detect it, when I say we, you and your doctor can detect it early enough and begin treatment early enough, the probability of being able to completely cure it is really well established. It's not, you don't need to be a genius. You just need to be there early. So don't wait.
So why do you think there's a challenge? Why do you think there's a challenge with that? Especially, is it a cultural thing?
I think there's some culture. I'm not sure if the audience is familiar with the Tuskegee experiment. Tuskegee is a university in Alabama, historically black. And I don't remember if it was the 40s or the 50s, but they ran an experiment where black men were exposed to syphilis. The men were told they were being treated for it, but in fact, the U.S. government was tracking the pathology of untreated syphilis. So these men were having relations with their wives and girlfriends who were then being exposed, children being born, all sorts of really awful things. And I think those types of memories create a lot of distrust in medicine, unfortunately.
Oh, yeah.
Yeah. The second thing, Jason.
Rightfully so, right?
Oh, absolutely. We understand that. And not everybody has as good an experience with their doctors and attending physicians as I did. And I recognize that. The other one is the stigma. In the past, the way doctors would find prostate cancer before a biopsy, they would do what's called the DRE, the famous. And I think there's a lot of stigma about that as well. And the good news is today, that was then. Some doctors still rely on DRE, but most doctors, if they're very progressive, are going to be utilizing your PSA and the changes in your PSA number as an indicator for whether or not you need to see a urologist or a urologist wants to do a biopsy. That's very rare. I'll never forget when I finished treatment with the radiation, the first year you follow up every 3 months for PSA tests. And they also did DRE. And I think it was the third test. So what is that? 9 months in, I dropped my pants and I'm waiting for the finger. And the doctor looks at me and he goes, no, I don't think we need to do that. And I looked at him. I said, huh? He said, oh, no, we don't need to do that. And you don't know how fast, Jason, I pulled up my pants and I sprinted out of that office because I wasn't giving him a second chance to say I made a mistake. I was bummed.
It's awesome.
Out of there, man. And so
the progression now is PSA. They monitor the PSA. They do an MRI. And then if something shows up on the MRI that's suspicious, then they do the biopsy. That should be the progression now. And more doctors are getting into that. But somebody had commented on one of my videos from Hawaii saying that they're not doing the MRI and the biopsy. They're jumping from a DRE to a biopsy, and then they're just still doing blind biopsies. And that is so behind the current standard of care.
I agree.
So
That's
it,
archaic, to go in. And so mine was an ultrasound guided.
yep.
The urologist showed me the image, and just between us, all I saw was a white cloud. If he could find a tumor in that, he was much better. I ended up, just to, complete the story. I ended up, like I said, being at MD Anderson. The urologist that I was working with, first he told me don't go on the internet. The second thing he told me, I'm more of a cutting edge guy. He goes, no, no, no. I do surgery. I do open surgery only, no laparoscopic, but my techniques are just as good. And I just, with a wink and a nod, said thank you. And I went looking for other ways to be treated. And fortunately, as I said, ended up even at MD Anderson, because I was young and healthy. Their first recommendation was surgery. They felt I had a great
Oh,
opportunity to
wow.
heal from it. I chose the radiation principally because of the location of the tumor anterior. So we don't have a really good biopsy of it. We don't really get, back then, the images weren't great. I just felt
Okay.
if the backup plan, if surgery failed, was radiation, why do surgery and radiation? Why don't we just do the radiation
Yeah.
and call it good? That was my thinking, you know.
Yep.
And
I
and
like that.
eventually, that's what they told me. They go, given the location of the tumors, we don't think we've gone past the margins outside the prostate, but this will give us a much better. When you're in surgery, you got to find the margin. What are you going to cut out? Whereas with radiation, you can just say, I'm going to include this area. And that was the approach. Another funny story, before you become a candidate for proton radiation, back then you had to do an MRI uh, with contrast. Yeah. And so I go in there not expecting anything, and they go to insert this balloon, and then they start to inflate it. When I say insert the balloon, it's into the rectum.
Yep.
I've never been under so much duress in my life. I mean, I'm screaming.
I'm so sorry.
No one
Yep.
prepared me for this. And so when the thing was done, I looked at the mirror when I got home. I said, dude, you can't do 38 of those. You're not that much man, admit it. And so I saw the surgeon that I'd already had visited and scheduled. I was scheduled for surgery. The Friday before, I get a call from my radiation oncologist there at MD Anderson. He goes, "You're a good candidate for Proton." And I told him on the phone, I said two things. A, I'm not that much man. I can't do 38 more of those. And he just started laughing. I mean, he was almost in tears. I said, "What's funny?" He goes, "We don't use that type of inflation device on our radiation." He said, "This barely." I said, "Really?" And I said, "Well," he said, "What's the other thing?" I said, "Well, I've already scheduled surgery. I'm going to be in surgery on Tuesday. I guess I'm on the path here. I'm on the glide plane home." He goes, "Well, if you really want to do radiation, just call them on Monday, and on Monday we'll and just cancel." So that's what I did. Monday I canceled. Tuesday I was at MD Anderson. They gave me the first shot. We scheduled more imaging for the proton, because they actually build these cellulite, they call them molds, which allows
Okay.
the
Yeah.
beam to be shaped for you. And so they do one for the
Hmm.
right hip and one for the left hip. And that was in 3 months. I went back for that imaging and got a second shot. I For me, and not everybody's the same, but for me, I gained in the first 3 months uh, 35 pounds. I went from like 165 right at 200. And I think I peaked at 205. And it didn't matter what I ate, how much I exercised. I mean, I was 205, 210 until my testosterone came back. And that was in September, October. So, yeah,
I
for me,
understand that struggle.
yeah, it was hard. My wife, I think she had it even harder because I thought I was holding it together, but I can look back now and tell you I was having anxiety attacks. I was uh, I was emotionally unstable. I can look back and see it now, but going through it, I don't know.
Yeah.
I
We
knew
don't
it.
often we need somebody from the outside to tell us how we're
Yeah.
feeling. Yeah.
Oh, really? Yeah, exactly. I had no idea. So it was hard going through that. And I sometimes wonder, would I do it again? Clearly, I'm happy with the outcome, but it was not free. It was not easy.
Oh, true.
Yeah, yeah. And I think everybody, deals with
So
something.
how did you find yourself taking all that experience and stepping into a role of advocacy or awareness? What drove you to do that, and what drives you to continue to do that so many years later?
I think for me, it's the opportunity to just give back. When I was initially diagnosed, and I found Texas too at MD Anderson. I think they mentioned there was this support group, and I went and found them and went to a meeting. I was just impressed with the way the meeting was run. The first part of the meeting is a clinician or a researcher talking about what they do and how they treat patients and the outcomes. Is usually a person in the medical community here in the greater Houston area. And then we take a short break, and it's a meeting for people that want to talk candidly about what they're experiencing. And it's run by one of the board of directors. So it just impressed me. And I thought, if I shall, because when you're first diagnosed, you just think to yourself, am I going to make it? You know,
Yeah.
and so that was my heart, that if I made it, I wanted to somehow give back. And after several years, I was then asked to join the board of directors, and then later asked to be the president and lead the group. But it's just a desire. There just aren't many health challenges that present themselves in a way that they can be cured, and prostate cancer is one of those. But again, early detection, and for me, just the opportunity to meet with people, to lead a group of survivors, I find it gratifying. I feel like I'm doing something positive, not just for the community, but in a roundabout way for myself, to be able to give back in that way.
That's awesome.
Yeah. So that's
Yeah.
kind of how
Yeah,
I
that's
how I
awesome.
do it. Yeah, that's it in a nutshell. We we meet once a month. We have an in-person group, and we also broadcast on the internet. We have quote members. I do air quotes because we don't require anybody to quote join. But for those that find
Okay.
us beneficial, we ask for a $35 annual donation, and that helps alleviate. We have two professionals that help us. We have a guy that runs our meeting on the internet, and so we
Yeah.
have him on salary for that day that he's there. And then we have a webmaster that we pay, but everybody else is volunteer.
Oh,
And
nice.
yeah, and so and most of the guys are retirees, so they have the time. I think I'm the only one who still pays into Social Security. Um, yeah,
Yep.
yeah. So that's kind of it.
So is that I've got a lot of viewers from the Texas area. Is that
Mhm.
a link that you could send me,
Sure.
email me, or
Yeah.
text me,
I
and
will.
then I can
Absolutely.
include that in the description? That would be
Absolutely.
awesome.
Yeah, I think
I
they would
think,
find it interesting. Thank you for that. Yeah. What
yeah,
else you got for me, Jason?
yeah. So how has cancer changed the way you look at your time, your priorities, or the
Mm,
way you live your life? Because it
mm,
sounds like you were doing a lot of the right things all the way up to your diagnosis, through your treatment, and continuing on. So, were there any changes? Is there anything that, you said you're spiritual? Was there a shift in that direction, or?
Well, I think spiritually we're always, growing in some way. And I've always been an active participant with church. I'm a minister. So I'm always up talking, either preaching or teaching classes, sometimes counseling in times of grief or stress. And so that's still been active. The one thing that's changed is I'm more of an itinerant preacher. I don't speak every Sunday. I try to take at least one off. and just
Oh, okay.
rest. Physically, when I first got diagnosed, my wife, like I said, she's very proactive. She kind of really took the lead for our family with diet and nutrition. And so
Oh,
today
okay.
I'm much more bringing in the vegetables than I ever was, much less processed food. When I say processed food, I'm speaking more of like fast food and junk food, much, much less. I'm not going to say zero.
Yeah.
Um, I've never really been a big alcohol person, but occasionally, I might have a glass of wine or a cocktail or something, but we don't have alcohol in the
Yeah.
house by and large.
Oh,
But I would say the exercise today, I focus more on a weekly calisthenic routine in the morning. I do it 3 to 4 days out of a week, and my wife and I tend to walk 2.5, 3 miles in the evening, say 4 to 5 days in the evening every week. When we're on vacation, we do more walking vacation than say a bus tour or other taxi. We do a lot of
yeah.
walking. And those are the sorts of things that I focus more on than anything else. When you hit these 60s, I probably have fewer years in front of me than I've had before. What's more important to me now is the flexibility, just the ability to raise my hand over my head, the ability to bend over and pick up a pencil on the floor, the
Yeah.
ability to walk and not be totally winded. And so I'm focused more on routines that allow me to maintain that than winning a contest or being noticed or recognized. I just want to have the flexibility. I want to have the endurance to do those sorts of things.
Okay. Wow. I like that.
I
Yeah.
tell people
Eh,
too in our meetings, the meeting after the meeting when we're talking as a group personally experiences that you don't know because you've changed your diet for the better how much it may help you. It may help you a
Yep.
lot, it may not help you much, but we know this for most of us, a change in diet, a change in routine won't hurt you. And so
Yep.
even if you don't notice it right away, I tell you to maintain it. If you're adding more vegetables and fruits and you're doing less processed food, you get a gym membership, you join the swim club,
Yep.
you join a walk, whatever it is, do that because for sure it won't hurt you.
Yeah. That's fantastic. I got one more.
Yeah.
So, this is an opportunity to speak directly to, somebody is going to see this video that's just diagnosed and they're searching for answers. They're in that spot you and I both were,
Yeah.
where we're going to the internet, despite what our doctors told us, and we're trying to get information. So, you're speaking directly to somebody newly diagnosed with prostate cancer. What do you want them to hear from you?
It's going to be okay.
That's
Take a
beautiful.
deep breath, blow it out real slow. It's going to be okay.
Yeah. There's lots of treatment options. There's lots of support. There's lots of
Thank you.
men out there going through it that have been through it. Yeah,
I appreciate
yeah.
what you just
All
said
right.
there.
Well, let's. Yeah, thank you. All right, let's wrap this up. I want to thank anybody that's watching that's made it through this far. I appreciate it, and for you, Thomas Reed, Dr. Reed, I guess, right?
No, no, not me, doctor. My
No.
family. Yeah, I joke
Oh
all the
yeah, you're
time,
the.
tongue in cheek. Yeah, right now I am not the least educated person. My son and I share that title. But if I shall live another year, I will officially be the least educated person in my family. But I wear that badge
Wow.
proudly.
That's
Yes,
awesome.
proudly.
That's so amazing.
Yeah.
Well, I've appreciated this conversation. This has been a great discussion. I've been looking forward to touching base with you again after our, sitting and talking at the support group leader conference. I appreciate your time, and I know our viewers are going to appreciate the information you provided.
Yeah, Jason, just a shout out to you and what you're doing, creating a platform for people, especially people that are being touched with this particular cancer for information, for encouragement and hope. May God bless you and may this this work that you're doing continue to maintain and grow and just hit more men and families in a very, very positive way. Thank you for having me today. I really appreciate this platform.
Oh, thank you very much. Yeah, awesome. And for the viewers, I love you all.
Likewise.